Check 1, 2, 3, 4.
Look around me, maybe. Hello, everybody. Good afternoon. Good afternoon to everybody in Rhode Island. Thank you for continuing to tune in to these press conferences each day. I continue to say that facts are what matters, and keeping yourselves and your families up to date is more important now than ever, and will continue to be so as we start to make a lot of changes and announcements in the coming weeks related to getting our lives back to a semblance of normalcy and getting back to work. Tomorrow, this press conference will be at 2:30, and then we'll be returning to the usual 1 o'clock time on Thursday and Friday, and then taking a break for the weekend. To those of you at home, you can see we're no longer in the stateroom. Today, we are at the Vets Auditorium in Providence. This was an attempt to allow the media into the room, but in a socially distanced and safe way. I want to begin today by thanking the folks at PPAC who've worked very hard to enable us to do this and who are graciously offering us this space. I want to thank Lynn Singleton, who runs the vets. He's been a fantastic partner and doing a great job to help us. I want to thank the hardworking men and women from the Alliance of Theatrical Stage Employees who staff this gorgeous facility and are helping us out, Rhode Island sheriffs who are here screening folks as they walk in to make sure there's nobody here with symptoms, and the cleaning crew, the state's cleaning crew from the Department of Administration who are here sanitizing in the morning and in the night. So I want to thank all of you for playing a role, and thank you to the press for going along with this new system. I highlight all that because, you know, it's going to take some adjustments. In fact, hopefully today looks better than yesterday. Yesterday was our first day. We heard, you know, there were some glitches. It was a little fuzzy on TV. Hopefully today it's a little bit better. Tomorrow will be even better. This is what life is going to be like for us for a while. We are going to be living with this virus probably for a year, hopefully less, but until we have a vaccine that's widely available or a therapy that is highly effective and widely available, which means we're going to have to change the way we do things, be flexible, and come up with innovations in order to get us through and allow us to continue to do our business. So we'll begin like we always do with the data. The data is on the screen. As you can see, it's a good data story. You see a continued plateau. We have 164 new cases. It's about flat. I mean, you'll see we did fewer tests Sunday and Monday. So we're not seeing a decline, which is what we hope to eventually get to. But it's very steady. It's a steady picture and a plateau. We're seeing a decline in the hospitalization rates and in ICUs. That's excellent. And very sadly, in addition to the 164 new cases, we do have another 14 deaths. And as the deaths mount, it's important that all of us take a minute to remember those who've lost loved ones and just think for a second of the toll that this virus has taken on so many Rhode Island families. As we go forward, it's important that we do whatever we need to do in order to accept that this is the new way of living, not try to fight against the new regulations, and not allow ourselves to get too frustrated. And that's not going to be easy. You know, I know that isn't going to be easy. But the truth of it is, if we try to just go back to the old way of doing things, we're going to get into trouble. Too many people will get sick. We'll see that incline again, and we'll have to do what we've seen in other countries that went too quickly in Hong Kong, in Singapore, and other places, and they had to pull back. And it is my goal, I am managing this in such a way with the number one goal of never having to reopen this economy again. I want to go slowly and never have to pull back. And what we know, and why people say, why is it so important to go slow? Here's why it's so important to go slow. What we are doing now is going to show up in our cases 2 weeks from now. So if over the weekend, lots of people got together in big family gatherings, or if in this week, when the stay-at-home order is lifted, and we start to push the limits, crowd into retail shops, get out there sooner than we should, get out in the parks and play contact sports with a lot of people, 2 weeks from now, we'll see cases go up, deaths go up, hospitalizations go up. And then, if they go up too much, at that point, we'll have to pull back. So the reality is there is no hiding from this thing. We cannot outrun the virus, and we can't hide from it. So try your best to live within the new rules, to stick with us over the next few weeks as we reopen in a slow and steady pattern. Because if we do that, then we can slowly and steadily open up and get to a place where we're all back to work. But if we push it too fast in the beginning, we'll overwhelm the system again, and we'll wind up right where we started. So having said that, I just want to remind you the gathering limit for social gatherings is 5 people. So what does that mean? And it shouldn't be a different 5 people every day. Stay close to home and keep your social network small. Keep your social network small in this phase. This phase won't last forever. It's weeks, not months. Hang in there with me for a couple more weeks. It will make a difference. There shouldn't be, barbecues, parties, house parties, big family gatherings. If you want to go shopping, that's great. Retail stores are open. Keep your distance, wear your mask, wash your hands, wait in line 6 feet apart. I will say this. People are asking me, how's it going? 4 days into lifting our stay-at-home order. I'm very pleased with how it's going. I'm very pleased. We're seeing, by and large, people following rules, by and large, people using the parks, but doing it responsibly. Most people are wearing their masks when they're at retail. Nearly everyone working in a retail operation is wearing their mask. And so that gives me confidence. The longer we see Rhode Islanders following the rules, then I have confidence that we can continue to relax the rules as we go forward. I do want to make a special note about hospitals, healthcare workers, and doctors' offices. So as I've said, in this first phase, the focus is getting people back to work. I want to keep a lid on social gatherings. That's why we kept a limit at 5. But we want to get folks back to work. And we are particularly focused in phase 1 on retail, and that's going very well, and healthcare. A lot of people are out of work in healthcare. Hospitals pulled back on all of their non-emergency procedures and non-critical surgeries. A lot of Rhode Islanders have been delaying on the healthcare that they feel they need, delaying on going to see their doctor, going to get that test, going to get that immunization. We've heard from the hospitals this week, hospitals are back up and running for non-critical surgery, procedures, and appointments. Here's what I want you to know if you're a Rhode Islander who has delayed a procedure or a test or a surgery. It's safe to go back. We're hearing from hospitals and large physician practices that patients are still afraid. The doctors are there, the hospitals are ready. They're doing more testing, more cleaning, more social distancing, more quarantining, more infection control, but patients are still afraid. So today, I want to say to the Rhode Islanders who are out there, I want you to have confidence. We wouldn't be allowing this if it weren't safe. These hospitals know what they're doing. They're safe. They are open for business. They're taking it slowly. They are ready to serve you. And if anything, if you've been delaying your health care for the past couple of months, it is time for you to muster the courage to go ahead and schedule that appointment. So if you get a call from a hospital, if it's time to reschedule an appointment or a surgery or a test, go ahead and do it. Go ahead and do it. I know you're anxious. But in this stage 1, we're going to walk before we run. We're taking it slowly. They are ready. They are safe. And I'm encouraging you to go ahead and get that health care that you've put off for the past 8 weeks. I'm going to fly through a handful of different topics, just tick through some of the important things. I want to hit again on the contact tracing diary. So I have been asking everyone in Rhode Island to create a diary. If you haven't done it, it's not too late. Do it, start it now. Start it today, start it tonight. If you have one, great. As we reopen the economy, you're going to go out more. You're going to leave your house more. You might go to the park. You might go to a shop. Next week, you might go out for dinner outside. You might be popping into the office to pick up some papers, and you might run into a colleague. So you're going to be seeing more people. That means these contact tracing notebooks are going to become more and more important. Eventually, we're going to, as I have said, we hope to get this to be more tech-enabled. We hope that your phone, if you choose to opt in, will be able to ping other phones that you come into contact with. But we're still a little bit away from that. And right now, the best thing you can do, everybody, very simple. It takes about 30 seconds at the end of the night. Just write down who you were with and where you were. Some people have said to me, well, Gov, I went to go pick up food at a restaurant. I saw some people, I didn't know who they were. Well, I know you can't write that down, but then write down where you were, what time you were at that restaurant, and what restaurant you were at. If you get sick, you will get tested. If you're tested positive, you will quickly be called by someone at the Department of Health. They're going to ask you to take out your contact tracing notebook so they can ask you who you've been in contact with, so we can go test those contacts or put them into quarantine. So I know this sounds simple. This will save lives. This whole disease is about limiting your network and allowing us to pinpoint where the problems are. So please just stick with it. Stick with it. I do it every night. Sometimes I forget, and then I go back the next day and make up for yesterday. So please, if everyone can do it, it will really help us enormously. And frankly, it'll allow us to keep opening the economy. Here's the deal. The more you follow the rules, the more and faster we can open the economy. The more people push the rules and don't follow the rules, the slower we have to go. So contact tracing diaries, a lot of people have said, do they still matter? I've been getting that question a lot. So the short answer is, not only do they still matter, they matter now more than ever because you're going to be seeing more people. I wanted to take a minute to talk about the workforce stabilization efforts that we have had underway. Obviously, you see every day in Rhode Island and frankly in every other state in America, this crisis has hit hardest in communal living environments, what we call congregate care environments, particularly congregate care healthcare settings, nursing homes, the veterans home, group homes, development homes for the developmentally disabled, any areas where you have groups of people in close proximity and those people are themselves sick or frail or otherwise physically compromised, that's where the virus thrives. Those are also the hardest places to work. And they're open 24/7. They're very stressful. And this has been an unbelievably difficult time on our frontline workers in those settings. As a result, in an attempt to respond to that need, I think 2 weeks ago, I announced a congregate care workforce stabilization fund. It was an effort to provide wage increases to low-wage frontline workers. So the custodian, food preparer, nurse's assistant in a nursing home, folks making $15, $16 an hour in a very stressful conditions. We got that up and running quickly. We have put that money out the door. Folks have said, what's the status? So today I'm proud to share that we've committed more than $8.2 million in additional wages to these frontline workers. So this is a $8 million raise into the pockets of some of our hardest working, lowest paid folks who've been on the front lines literally every day, 7 days a week for the past 8 weeks. More than $6 million of that is already out the door, and the other $2 million should be out hopefully this week. This funding is expected to benefit more than 10,000 workers at more than 160 facilities. As I say, all folks who make less than $20 an hour or less. This is a temporary measure. It's set to expire June 1st. The intent, this is not perfect in any way. As I've said from the beginning, no program we're rolling out is perfect, but it was an attempt to help stabilize that workforce and get us through until June 1st, hopefully the worst part of the crisis. Another, I suppose, piece of good news for nursing homes. We heard yesterday that the federal government, FEMA, is going to be sending a limited amount of personal protective equipment directly to nursing homes. They say they'll be starting that next week. So if you're a nursing home worker or administrator out there, this is welcome news. This is good news. We at the state are going to continue to do everything we are doing, and we are every week able to push out more PPE and more surgical masks. On top of that, the federal government is going to send you once a week, every week for the next 4 to 5 weeks, a specific supply of PPE for your workers in nursing homes. So it's a little bit of good news. Okay, I want to talk about two other things. I want to talk about distance learning for a second. The reports from distance learning continue to be, by and large, very positive. Attendance is high, engagement is high, teachers are working probably harder than they've ever worked, and students are really leaning in and engaging. There are challenges, for sure. There are challenges in particular with kids who have special needs, kids who don't speak English, and kids who are at lower income, don't have great technology in their house. So every week we try a little harder to make sure we meet children where they are and fulfill their needs to make sure that they are learning. In particular, one of the groups for whom this is difficult are low-income kids who might not have Wi-Fi, might not have a phone, might not have a computer. And the reality is internet access obviously plays a huge role in distance learning. We've been working very hard to close these gaps. At this point, we believe we've been able to extend access to internet to nearly every household in Rhode Island. Our best guess is there's 1 or 2% that we haven't gotten to. If you're one of the 1 or 2% out there, if you're a kid or a mother or a teacher and you're listening to this and you don't have internet access and you're still struggling, I want you to call me. Call the governor's office, let your teacher know. If you're a teacher or principal, call Rhode. We are determined to get to 100% of our kids to have access to internet and Wi-Fi and a computer so that they can do their schoolwork. Right now, as I say, we think we're at 98, 99%. We are there because we've done a lot of partnering with some excellent private sector partners. A couple of months ago, I announced all households that have a smartphone with a Wi-Fi hotspot and have cell phone service from Verizon, AT&T, T-Mobile, and Sprint will be able to activate that hotspot for free. Normally it can be expensive. No activation fees, no usage fees, no overage fees. At the time, I said that service would extend to May 13th. We've gotten rave reviews. A lot of people are using it. So I want to thank those 4 providers. And today I'm announcing that all 4 of those carriers have agreed to extend that free service through June 30th. So that'll get every kid through the end of the school year. Again, I want to thank Verizon, AT&T, T-Mobile, and Sprint. It's been great work. It's been a great partnership. You've enabled thousands of kids to be able to continue their education. And for everyone out there, I want you to breathe a sigh of relief. We've been hearing from a lot of people. Until June 30th, hotspots are free. You can continue to use them. Finally, I want to make a note about, basic note about equity as we go through this crisis. We have talked at length and nearly every day about our Latino community and how hard hit they've been by this virus. I want to make clear, it's not just the Latino community. We are concerned with the high incidence of COVID-19 in all communities of color. And we know that it is the communities of color that are being disproportionately hit by the virus. You have asked many times, why is that? And I'm not sure we know exactly why it is. We do know that a lot of the underlying inequities in our healthcare system and in our public health system that have existed long prior to COVID-19 exacerbate this virus. And I have to give credit to Dr. Nicole Alexander-Scott and her team, who've been working for years on health equity zones, making sure that we have some basic equity in public health and healthcare delivery, so everyone, regardless of race or income or gender or neighborhood, has access to high quality healthcare. And we are doubling down on those efforts now because We don't know exactly all the reasons, but why communities of color are being so disproportionately affected. But we absolutely know that one key reason is that if going into this, you lacked access to primary care, you had an underlying health condition that wasn't being cared for, you struggle to get access to health care, you don't know how to go get tested, you don't have a primary care physician, it makes this worse. And so to that end, we are working very hard to make sure that we beef up our access to health care for everybody. Also testing. So we now have testing sites in the community in Oneyville, in Pawtucket, in Central Falls, in Woonsocket, in East Providence, in Newport, on the south side of Providence. We have a new rapid testing site in Central Falls in partnership with CVS. Thank you to CVS. And we're going to continue to add more of these walk-through sites and in-community sites in communities that are the poorest and that are the toughest hit. I want to be clear. We're doing a lot. We're not doing enough. So every day we try to do more, and we need to continue to hear from the community. I have a Latino advisory group who's been fantastic, bringing us the concerns of the community. We're going to expand that group to other communities. Continue to let us know what you need so that we can continue to support you today, tomorrow, a week from now, a month from now, 6 months from now. I've created an equity considerations working group. As you know, I've divided the work of meeting the needs of the crisis into different work streams. We have a specific work stream who thinks about nothing but equity. And I am committed to doing better. We've done a lot, and we're gonna do more. And I'm asking members of the community to continue to reach out to us. One simple thing you could do, as of, I think about a week ago, this press conference is streamed live every day in Spanish on my Facebook page. So if you're on that Latino Facebook page, it's a great way to get comments to me. Let us know, and don't be afraid. Don't be afraid don't be afraid of your immigration status. Don't be afraid to reach out. Don't be afraid about your employer knowing that you need help. Don't be afraid or ashamed. We know this is hard. We know it's hard economically. We know it's hard on your families. We know many of you live in crowded, cramped living spaces. We know it's hard to find a test. You might not have a doctor. Reach out, because I am telling you, there's more to come, and we are committed to making sure every Rhode Islander, every one of you, regardless of where you live, what country you've come from, what language you speak, what is the color of your skin, we want to help you and get you the support you need to get through this crisis. And with that, I'm going to turn it over to Dr. Nicole and come back for questions.
Good afternoon, everyone. Thank you for joining us today. To get going, we will get started with data. As the governor said, we have 165 new cases to report. There are 277 people currently hospitalized. Of these people, 72 are currently in the intensive care unit, and 53 of those 72 are currently on a ventilator. Unfortunately, we have 14 additional COVID-19 associated fatalities to report. These people ranged in age from their 60s to being older than 100 years old. Our deepest sympathies are with the families of these precious Rhode Islanders who we have lost. Another quick update that I want to provide, which is also a follow-up to a question I was asked yesterday, is about nursing home testing. Yesterday afternoon, we did complete our first round of cyclical testing in all nursing homes in the state. That means we tested residents in all of the 85 nursing homes in the state. As I've explained in the past, we are going to be doing routine testing in nursing homes as the aggressive, comprehensive way to continue to assess our understanding of what's going on in our congregate setting, nursing home locations. So now we will be restarting the cycle, beginning with homes that have confirmed cases and going across through the state. I really want to thank General Callahan and the Rhode Island National Guard for their tremendous effort and support that they have been providing to help us accomplish this as effectively as we have. I also want to thank all of the administrators at the homes who have been great partners, and certainly all of the staff. One other update that I want to provide from yesterday relates to the announcement we made about restaurants opening for outdoor dining. We had said that after people make reservations, restaurants are going to keep their contact information for 30 days, should that information be needed for contact tracing. However, if someone who ate at the same restaurant that you ate at were to test positive for COVID-19, that does not automatically mean you will be asked to quarantine for 14 days. It's evidenced by the fact that we are working closely with businesses and restaurants to keep the distances in place and to support what's needed to keep everyone safe while they are enjoying their time at a restaurant in Rhode Island. You would not be asked to quarantine unless you were a direct contact of someone who tests positive for COVID-19, which is unlikely to happen in a restaurant setting unless it's someone that you are directly at a table with. This information that we are asking restaurants to hold as a precaution is information that would only be requested by the Rhode Island Department of Health if it were needed. As the governor has said, this is new to all of us. We are going to continue answering questions and making these kinds of clarifications as we go, with everyone assured that there is solid public health guidance, ensuring that there will be a safe environment for everyone to return to as we reopen the economy slowly and steadily with the objective of moving forward. We are also going to continue working with and partnering with businesses throughout the state. I really want to give kudos to Secretary Pryor and his team at Rhode Island Commerce, who have been working literally around the clock with us and has been doing a tremendous job supporting businesses and providing what's needed. We are going to be doing even more over the next week and beyond to help provide the communication and support that all businesses need. That means we'll be activating further email blasts, Facebook events, social media campaigns, and much more, all so that we can continue to be available to the businesses as we go forward. For example, at 6:15 p.m. tonight, we're doing another Facebook Live event to answer the questions specifically of restaurant owners. One of the reasons why we are making such an effort to answer questions and troubleshoot issues with business owners this week is because businesses should have their COVID-19 control plans completed by May 18th, which is next Monday. So what is a COVID-19 control plan? A COVID-19 control plan for businesses is a plan that is intended to protect businesses, employees, customers, and really all of Rhode Island by specifying the actual measures that a business will be taking to prevent the spread of COVID-19. We know that businesses want to do this. It's important for everyone to be aware that it is being done and that there is an infrastructure across the state to ensure the safety of everyone who's engaging with businesses so that we know people can feel comfortable then returning to work, engaging with businesses, going to restaurants, going to retail shops. We also know that this has been an enormously stressful and challenging time for business owners and managers. Through the COVID-19 control plan template that we've developed and posted in English and Spanish on reopenri.com, we can make it available in other languages as we need to. We want to give owners and managers a simple structure for how to approach this, how to take the steps forward that can reassure everyone of the safe environments in place. We want to make sure it's clear we're here for you. We want to support you. We want to facilitate you taking the steps that are needed, and we want all of Rhode Island to know that that's taking place. If you are a business owner and you haven't looked at the COVID-19 control plan material we have online at reopeningri.com, now's your opportunity. Please do so. Go to reopeningri.com. You can contact us with questions and also keep an eye out for the different online events we're going to be organizing to be available to clarify things for you, to answer questions, to help give you what you need to make sure that you're ready. Before opening things up for questions, I want to make just one or two last notes. This week is National Skilled Nursing Care Week. This is a national observance that invites us to celebrate the relationships that exist between skilled nursing care center residents, family members, staff, and the greater community. These facilities that we have throughout Rhode Island are such important parts of the Rhode Island community. Things are obviously a little different this year in terms of our experiences together, and we're relying much more on technology and other means to be able to stay connected. One thing that has not changed and helps us in observing National Skilled Nursing Care Week is the fact that staff in our skilled nursing facilities are playing a critical role in caring for residents and becoming like a second family for those residents. That absolutely deserves to be honored and celebrated today and every day. So with that, I want to get us started with questions. Thank you.
Governor, question for you. Dr. Fauci today in his testimony at Congress expressed concern about states and cities reopening too early. Last week, the Harvard survey identified 9 states that they said were ready to reopen. What are your concerns with both the Harvard study and Dr. Fauci? Do you have concerns that this is reopening Rhode Island too soon?
Yeah, I don't. If I did, I wouldn't be doing it, but it's a balance. So, right now, Rhode Island is the first state in the Northeast. I'm the first governor to have lifted our stay-at-home order. So it is a fact that we're going ahead of Massachusetts, ahead of Connecticut, ahead of some of our neighbors. I made that decision because we had 14 days of a plateau, our hospitalizations were going down, our testing is the highest per capita of either any state in America, certainly any state in the Northeast. And our experience here on the ground is such that I felt it was safe to go ahead and do this. There's also a balance. There's a relationship between economic health and physical health, and it is not healthy to keep so many Rhode Islanders out of work for so long. So in light of all of that, I made the decision, difficult decision, to lift the stay-at-home order with a focus on getting people back to work, but I kept the social gathering limit at 5. What I am concerned about is if we go too quickly. So I feel that we are in a good place right now, and if everyone continues to follow the rules and we go slow and steadily, walking before we run, whatever analogy you like, keep your social network small, limit your engagement with other people, follow the rules, put a toe in the water for these next 2 weeks, while we get some actual lived experience to see, is Rhode Island ready to continue the reopening? I think it's appropriate, and I'm not overly concerned. I wouldn't have done it if I were.
Governor, with that said, a lot of restaurant owners are expressing.
If I can follow up on that, what gives you confidence you won't have to step back and pull back and reimpose those
Yeah.
restrictions?
So, right, as I said last week, I feel I am governing from a position of confidence in the people of Rhode Island. I have watched Rhode Island adapt and be flexible for the past 2 months, and by and large, people are following the rules. You know, this weekend we checked on a few hundred businesses. 95% of the employees in those businesses were wearing their masks. We think about 75% of customers were wearing masks. By the way, 75% isn't good enough. It's got to be 100%. If you go out, you're going shopping, fine, great, go out, spend money, help the economy, wear a mask. It's very simple, it's easy to do. By and large, people have been following the rules. We were out all weekend looking at the parks. I realized the weather wasn't great, but there weren't big congregations. Folks are not trying to sneak into nursing homes as we once saw that they were. So we are looking every day, we're out observing, are people paying attention? And at the moment, the behavior of Rhode Islanders, it's like people get it. People get it. Breaking the rules only hurts you and your family. Breaking the rules only means we have to go slower to reopen this economy. So as long as we see that people are following the rules, we'll get more and more confident that we could continue to put the foot on the gas and open more.
Governor, with the announcement yesterday that you're going to open outdoor seating at restaurants, you know, we're hearing from restaurant owners they're still concerned these restrictions. A lot of them won't be able to open. They don't have outdoor space. They're concerned about the limit on tables, the reservation system. What do you say to those people who still think they may go under even with this opening?
So here's what I say. First of all, my heart really goes out to them. If you look, and it isn't just in Rhode Island, it's all over the country. If you look at certain industries, retail, restaurants, hospitality, hotels, tourism-dependent businesses, it's devastating. There's no way to sugarcoat it. I talk to these people, Stefan talks to them. It is very tough. So what I tell them is we're doing the best we can. If we relax these guidelines too much too quickly, it's going to be worse for them because then it'll take even longer to get back up and running. I am sure the right thing to do is to go slowly. You know, the question Kate asked, you ask all the experts, going slowly is absolutely the right way to go. It doesn't make it easy. If I were them, I'd be frustrated too. It's tough. They've been out of work for a long time. So what I'm trying to do is do everything I can to help them earn a little more money. You know, this weekend we allowed restaurants to also do takeout for mixed drinks. It's a tiny thing, but we've heard from them it actually helped. Outdoor dining is another tiny step, and I hope it helps some of them. We are working really hard. I hope to be able to have an announcement in the next week or so providing small business relief using some of our coronavirus relief fund to target the smallest businesses and industries that have been most hit. So we're going to do everything we can to give them support, to tide them over. I hope some of them do outdoor dining, and I hope it's just a matter of weeks before they're back doing indoor dining. As it relates to the reservation system, the plexiglass, the hand washing, that we just have to get used to. I know it's a drag. I know it's more expensive. It's what we have to do. It's going to be here to stay for probably a year. So the sooner you figure out how to do it, the better off we're all going to be.
Bill?
Governor, I conducted a poll in the last 24 hours of hundreds of Rhode Islanders and found that 84% say they will not go to a restaurant even with outdoor dining during phase one, whether it's because they feel it's an unsafe situation for themselves or for workers. What do you say to the consumer here in the state?
Yeah. So you put your finger on something that we're going to have to work through. I just referenced today hospitals. You know, Nicole and I are in very close contact with hospitals, obviously. And they are saying, hey, you know, Gov, we are ready. We've worked for weeks. We are ready. We are confident. We are physicians. We wouldn't be doing this if we weren't totally confident we could take care of people. But patients are afraid. And so what I say to them is, I hear that. I understand that. You've been locked in your house for 2 months. This is a scary thing. This virus is very serious. I hear that. But I also will say it's time to be brave. It is time to start coming out again, slowly, carefully, with the new rules. So my birthday's Sunday. I told my family, take me out for dinner next week. Like, I plan to go out. I'm going to try to lead and show. It's, I'm following my own rules, right? I wear my mask. I do this. I'm not saying it's safe for you to go out. It's safe for all of us to go out. It's going to take some time. That's the other reason I want to go slow. We have to build confidence. The other thing is, if you start to break the rules, a lot more people get sick, then people will really not have confidence. That is the other reason to go slowly. So I would say, I hear you. I know you're afraid. I believe it is safe. I'm going to eat my own cooking, so to speak. And I would encourage you to slowly get out there and follow these rules. And after you do it a few times, I think you'll be confident.
Clarify what exactly, when you say if a lot of people get sick, we might have to roll back. What's a lot of people? What number?
Thursday. I'm going to talk about that on Thursday. I'm going to give a detail of when I think we can move from phase 1 to phase 2, and when I think we can, what kind of a surge we would see, which would cause us to have to go backwards.
Governor, I asked you several weeks ago about layoffs for state workers, potentially furlough. Since then, Pennsylvania's stopped paying 9,000 employees.
Yeah.
Your friend Eric Garcetti has said for Los Angeles city employees, 26 days between now and the end of 2020. So with an $800 million projected deficit now. And just as an aside, somebody else asked you, well, what about the JCLS? What about the legislature? You said that's their deal. The Speaker's office tells me they are following your lead. So, and with all due respect to Director Smiley, who answered it last time, I'd like to hear from you.
Yeah. No, look, it's a fair question. With an $800 million deficit, it is hard to see how we get out of this without doing furloughs. So I hear that. What I've been trying to do is not contribute to the state's unemployment rate, and also use as many state employees as possible in aid of the crisis. So what does that mean? Now we have contact tracers. I think we're up to 125 contact tracers, plus or minus, over 100. I'm trying to push state employees to help us with that work. There's data analysis to be done. So what we're trying to do is take state employees who are otherwise not fully engaged and put them in aid of the crisis so that they can help us with our work. Having said that, we just have started the work of looking at our budget in earnest now that we know how big the hole is. And I would love to avoid furloughs and layoffs, but I don't see how we're going to be able to do that.
reality also that you do come out financially ahead. You talked about adding people to unemployment, but that only pays a portion of their salary. Ultimately, and now with this whole $600 that the feds are kicking in, I mean, every other state has said this is inevitable, and Rhode Island hasn't taken any moves toward that yet.
I wouldn't say that. Not every other state has already done furloughs. I think many have, some have. I don't think it's every, I don't even think it's most. But it's something we have to look at. You know, you're right. I have to find money. And by the way, this budget's going to be brutal. I don't know where we're going to find $800 million. Everyone's going to be unhappy. Everything is on the table. Everything. You asked about JCLS. Everything is on the table. You can't fill an $800 million hole. And also, we're going to have to think very differently. You also can't just do traditional cuts. There's going to have to be some reorganization around it. I will say this. I am continually told by our federal delegation, by the Trump administration, by the Vice President, by the Secretary of the Treasury, that there's very likely to be another stimulus package to help states with exactly this problem. And they tell us we're going to have a lot more guidance in 2 to 3 weeks, last week of May. So I am holding out for that.
This year, then what's 2022 look like? I mean, that's the one-time fix that Rhode Island's been using.
Yeah, fair enough. You can't do it with one-time fixes. I said that already. It's a huge hole. It's going to be a lot of challenges, and there's going to have to be some structural changes. Having said that, it's very hard, if not impossible, to do a budget today when the federal government might make a the last stimulus was $1 trillion. We received $1.25 billion. So, if I'm going to get $500 million in federal aid to fill the budget, it's going to be a very different budget than if we get nothing. And I'm told that that's 2 to 3 weeks away. So we're just putting the plans in place. But to answer your question about furloughs, I don't see a way that we can get through it without it.
Governor, you mentioned the $8.2 million in additional hazard pay for some workers. Is that all new money, or is that some of the money you had promised previously a couple weeks ago?
No, that's all the money we promised. That's from the COVID relief fund. I'm sorry, I was just giving, that's not a new announcement. That's a fund that I rolled out 2 weeks ago. It's called the Congregate Care Workforce Stabilization Fund. We rolled it out 2 weeks ago. I'm just reporting today that it's been implemented and that money is on its way out the door.
Governor, good afternoon. I want to just stay with the restaurant theme for a moment because it seems to be what everyone is talking about. And they're questioning, and here are some of the things, real specific things they're saying. Why 20 tables? If someone has the room, why not more than 20 tables? Why 8 feet apart instead of just 6 feet apart? You also have prominent restaurants, Capriccio, Old Canteen, strictly inside dining. A restaurant owner said, why not give us a fighting chance to spread the tables out? Because many of them are saying, like Griswold's Tavern that was written about in the Wall Street Journal, that are just saying this formula will not work. So why not let us open now and have a fighting chance?
So here's what I'd say to that. Recognize there is no one right answer. Yesterday Governor Baker came out with the beginning of what their guidance is. Every governor is doing it the same, but a little different. So is there a magic around 8 feet? No. Here's what we know. Every public health expert says 6 feet because they know from studies how 6 feet is safe. So we said 8 feet because there's room between tables. There might be a server who's in between 2 tables. We just thought for ease of administration, if the tables were 8 feet apart, people would always be 6 feet apart because you have to get up from your table, maybe you have to go to the restroom, the whole thing. We're not ready for in-room dining. We are not, look, I am the first state, Massachusetts and Connecticut aren't even doing outdoor dining or they still have their stay-at-home orders in place. We are not now ready to safely open in-room dining. So the choice isn't in-room dining or outdoor dining. The choice is outdoor dining or nothing. And we just felt, my whole theory here is slow and steady, let some people get back to work if they can. And when we're ready for in-room dining, we'll go to in-room dining. And by the way, I think it's weeks, not months. So the outdoor dining is just, it's a little bit like allowing mixed drinks. It isn't perfect. It's a little more money to help tide you over for a couple more weeks until we can get to the business of in-room dining. And based on everything I know and all the experts I listen to and the shape of our curve, I feel that's the safest approach. And to the question somebody asked about confidence, the last thing we want to do is open too quickly, let the restaurants fill up, lots of people get sick, and confidence goes down. So it is frustrating to be sure. If I were them, if I were those restaurants, I'd be complaining too. I get the frustration. I'm not faced with any good choices, and I'm doing the best I can, and I think that this is not safe right now to do indoor dining.
Quick follow-up on that. Reservations, is it practical? We're riding along, we want to stop and get coffee at the butcher shop. And
For now, it's what it is. I'm not saying forever, I'm saying for now.
It's a family of 6. Should one person wait in the car? How would that?
Try to follow the rules. Right, I'm saying try to follow the rules. That's all I'm saying. Just try to follow the rules. Don't try to ask what if and push the rules. And look, common sense, at some level, I said this a week ago, I am not going to be able to, nor do I want to be in the business of legislating and tracking every move everybody makes. You should know by now what the rules are, and you should try your hardest to follow them because it'll make your life, your family's life, and your business's lives better.
Governor, to follow up on the questions that came up in some of your remarks about further federal stimulus that will go to the states, the national press is considerably less optimistic, I think, than you've been. I mean, the New York Times reported this morning that the negotiations on the next stimulus are essentially at deadlock. And the possibility is strong in the view of a number of members of Congress who spoke to the Times that there may not be another stimulus that could be agreed to, or that any stimulus that came through would have very onerous restrictions on the use of the money by the states. For example, not being able to make up the revenue shortfalls. And I know you're in regular communication with this federal delegation from Rhode Island, and they've given you assurances that they are more optimistic. But I'm concerned about the increasing divergence between the national press and that information.
You know, I can only, listen, it's Congress. It's a challenge to predict. It is political, and we're talking about a lot of money. I can only tell you what I know, right? I am not a member of Congress. I am not in Washington. Thankfully, I am here in Rhode Island and serving the people of Rhode Island. So I'm just telling you what they continue to tell me. This isn't a red state, blue state thing. I hear from red state governors every day whose budgets are a mess. You know, to the question earlier about furloughs, you see in Ohio, struggling and beginning furloughs. There's not a state in America whose budget hasn't had a big hole blown through it on account of this crisis. And it is my firmly held view that the Congress has to do something to step up to meet the needs of the American people by providing an additional stimulus to states. Now, will it have strings attached? Almost certainly. Will there be restrictions on what we can spend the money on? I would have no doubt. Will, through a negotiation and the sausage making, it be less than we need? Probably. But I'm fighting for it because we need it. And if, God forbid, it gets to a place where we don't get any more, then we will balance the budget. But I'm just telling you, here in this state, those consequences will be quite devastating.
Governor, we're hearing from some workers on unemployment who have had their benefits stopped or maybe their account frozen. Have you heard anything about that, or anything in terms of accounts having to do with the fraud investigation? People can't get through. Can you elaborate on that and what you can tell these people who may be experiencing now difficulty even after they had started to receive benefits?
Yes, so I would say they should call DLT. It's hard for me to know the exact details, but we have there is, as you know, speculation that we have had some fraud. By the way, it's not just in Rhode Island, it's a handful of other states. And so we have had to freeze some of these accounts until we figure out the extent of the fraud. Having said that, what we're trying to do is reach out to people as quickly as we can, because we don't want to freeze the accounts of people who have a valid claim. So all I can say is we're doing our best. And if you know specific people, like literally send them our way, because we're trying to seek out people who deserve it. But in trying to stop the bleed and stopping money going to fraudulent people, we have frozen some accounts.
Following up on Brian's question here, so some are saying that they haven't received a check in 8 weeks. I mean, is there some kind of?
That's strange.
That's what we heard. I mean, we heard
The
that,
only thing I can think. So let me say this: the average time we are paying on average in about 10 days. Longer for some of the PUA, not to get into the weeds, but if it's traditional unemployment insurance, it should be getting to you within 10, 11, 12 days. If you're applying for the PUA and you are someone like a waitress or a hairdresser or self-employed person, that should be getting out pretty quickly. If it's a more complicated request for PUA, so you haven't lost your job, but your doctor says you can't work, we are putting those through tougher scrutiny, and so those are taking longer. The other reason it could be delayed is if the information you gave us is incorrect. So the problem where we're seeing the most delays, incorrect social security number, lack of information, misinformation, those take longer. But if you're getting us all your information, if all your information is accurate and it's kind of a cut and dried case, we should be getting the money out to you in 10, 11, 12 days. So anyone, again, reach out to me directly, reach out to DLT. In general, every time we've checked into these cases that are taking a long time, there's something going on. Like there's something going on. They didn't give us the right information. It's inconsistencies. They're not eligible. It's taking longer to figure out their eligibility.
And just a quick follow-up. As far as these unemployment claims are concerned, do you have any kind of projections on what percentage of these jobs are just going to be permanently lost?
We don't. You know, I talked yesterday to the Secretary of Labor, and he said to me that they recently did a survey, and they were finding that the vast majority of people, they talked to people, felt that they would eventually, their job loss was temporary. So, which is very different from, say, 2008, 2009, when you did similar surveys. The majority of people thought their loss wasn't temporary. And that is here's how I think about it. We're trying to study this. Most people will get their job back. This is temporary. The restaurants, right? We're just talking about restaurants. They will reopen. Some won't make it, which is tragic. Most will. They will reopen. They will get their jobs back. The people I worry most about and who we have to figure out a solution for are people in low wage, low skill positions in industries that were already declining. Brick and mortar retail, for example. I worry a lot about that. You saw J. Crew went bankrupt. This COVID crisis is accelerating so many of the really difficult trends that we saw in our economy already. And so we got to be there for those people to help them get a new job and get some new skills, because those are the ones that I worry most about. But I think for most people, they will get their job back, and we hope pretty quickly. Kim had her hand up a long time.
Just a quick two-part question. Can you say how many of the fatalities today were associated with nursing homes or congregate care? And also, we got some new data on cities and towns by cases by city and town. And we're seeing some spikes in East Providence, Johnston, West Warwick. Do you believe that that's associated just with nursing homes, or are those cities seeing more cases in the general public?
So thank you for that. In terms of the nursing home data, for the unfortunate fatalities, approximately 340 of our fatalities are associated with long-term care facilities or assisted living facilities. There have been between 5 and 10 fatalities associated with other congregate settings. And of the 14 fatalities we announced today, 13 were associated with long-term care facilities. So to really finish on that point before going to your second point, this is not about the facilities itself. Similar to what I shared, where the Department of Health has been doing all of the infection control steps. And because of access to the community and engagement, we tend to see this. So we want to make sure that we are continuing to support our nursing homes. The governor shared, for example, that FEMA is going to be delivering personal protective equipment. For the nursing homes, there's going to be 1 week in May and 1 week in June that they are aware of, that they'll be receiving the PPE. So it's helpful for them to know that that's how it will be coming through. So the effort that we're doing, completing the cyclical testing and starting again, being as comprehensive as we can, is the key for everyone to be aware of, and to know that there are people in nursing homes who are doing well, who are being cared for effectively. That's an important message to make sure we continue to emphasize. In terms of the cities and being able to understand the data for Central Falls, for all of the cities, Providence, we are reviewing that on a regular basis to help understand what is the percent positive, how are our communities at highest risk being impacted. I'll finish with echoing what the governor said. The work prior to this particularly with our Health Equity Zones initiative, to really establish an infrastructure that can be in place in our communities disproportionately impacted to address all forms of health. That includes their health care, but it also includes access to fresh fruits and vegetables, access to quality education that we're all working hard to provide, access to adequate transportation and housing. That's really the comprehensive picture that we're looking for with the infrastructure that Health Equity Zones have put in place to establish, so that we can now leverage those infrastructures, invest in the public health support, invest in the education and the access to transportation and housing that's needed, and help the communities disproportionately impacted now have what they need to respond effectively to this crisis. As we're expanding testing and bringing in those services and support, leveraging the infrastructure we want to continue to invest in, that's how we're seeing those increased cases. We want to identify that and get them into the quarantine and isolation and the support that they need, so that we can make sure as we're going forward, it's having all communities in Rhode Island have the infrastructure in place to ensure equity and to make sure that there aren't any repeat waves that are occurring. Because if it happens in one community, it's happening throughout all of Rhode Island, and that's why it's key to make sure the investment is equitably distributed, leveraging infrastructures that we've worked hard to put in place at the community level.
Thank you, everyone. We'll be back tomorrow.